To the extent that we live our lives in a manner that is consistent with the truth in our heart, we thrive.
Welcome to the Meyer Clinics podcast, and you just heard a quote from one of your hosts, Dr. Lisa Day. Join our licensed clinical professionals from various backgrounds as they discuss fascinating mental health topics with a wide range of guests. Meyer Clinics is a Christian counseling organization with multiple clinics nationwide dedicated to treating the whole person, emotionally, physically, and spiritually. Welcome to our listening family. We thank you for joining us. Hi, everyone. Kristen Walker here. We're here with Dr. Lisa Day. Hello, Lisa.
Hi, Kristen.
Today, we're going to talk about living with bipolar disorder. And I thought, you thought, Lisa, it would be a good idea to first, for anyone that doesn't understand or know what it actually is, we can give a definition of it first.
Absolutely, because bipolar, I think, is thrown around and the diagnosis is thrown around, or people will say, oh, my goodness, you're so bipolar, that oftentimes it's misconstrued. And so I think it's at least worth a few moments in identifying what bipolar disorder is. And in the field of psychology, there's basically three categories, if you will. We've got bipolar 1, we've got bipolar 2, and then we've got this tongue twister called cyclothymia. And bipolar 1 is probably the most severe, well, it is the most severe and most debilitating of the bipolar disorders. And what we're going to see with bipolar 1 is that individuals are going to have a manic episode that lasts at least a week long. And in that manic episode, you're going to see euphoria, energy, anger, reckless spending, reckless sex, off the walls, not sleeping, crazy behavior, and it's solid and it has to last for at least 1 week. And then that will be followed by at least a 2-week period of pretty significant severe depression where that person has difficulty, getting out of bed or, attending to their responsibilities. And then unfortunately, the full meal deal is that you can have bipolar mixed, where someone is experiencing both the mania and that debilitating depression. And in my line of work, that is the most dangerous client. That's the one who's most likely to hurt themselves and in fact kill themselves. And sadly, that diagnosis is the most prominent diagnosis represented with successful suicide. So it's a serious condition. We have another form of bipolar that we call bipolar 2. And it's similar, not as severe, and the lengths of time are a little different. So the mania phase is a few days short. It's at about 4 days, and the depressive stage is, again, about a week to 2 weeks. But the symptoms are not as severe. Bipolar 1, you're likely to see those people in the hospital when they're in either a manic, a depressive, or a mixed phase because of self-harm and because of the erratic behavior. And then the cyclothymia is really just a longer term, yet one step milder version of periods of euphoria, elated mood, or could be agitated mood, switching off with depression. It's milder, but it's a cyclical. So you'll see a pattern of highs, you'll see a pattern of lows. But oftentimes with cyclothymia, and even with the bipolars, people enjoy the mania. It's not necessarily dysfunctional. But with bipolar 1, it's dysfunctional. It's out of control. But the thing that I want to emphasize out of the gate that many people don't realize, is many people believe that bipolar disorder, manic depression, is a form of depression, and they just think it's more extreme or more erratic. And truly, in the field of psychology, and certainly with my approach to working with folks with bipolar, it's not just a mental illness. I really need to emphasize that it is a disease of the brain. And so it's, oftentimes as we talk about this today, living with bipolar disorder, living with a family member with bipolar disorder, the message will be just get out of bed, or just settle down, or let's pull it together, or why are you always like this, or can't you just enjoy your birthday or this vacation or our travel plans? And it's so important to realize as we walk through this today, Kristen, that individual can't. It's a disease. They're not able to reel it in. They're not able to, quote unquote, get it under control. And, the impact that that has on not only the individual suffering with bipolar disorder, but family members. It's profound. It's profound.
And you'd say they can't, meaning they can't unless they are getting treatment.
Oh, absolutely. And we'll talk a little bit about that, the treatment component. I think the last study I looked at said that on average, from diagnoses to treatment, that an individual, it can be up to 10 years from a first episode to diagnosis and treatment. And on average, it's 5 years. So, we're thinking, bipolar represents not a huge portion of population, even though that word is tossed around a lot. Bipolar, if you actually look at statistics, is about 1 to 2% of the population. But when it comes to getting help, there's such denial and such minimization that it takes a very long time, not only to get that person into treatment, but then to find the right provider and then to find the right treatment course. So it's a challenging, it's a super challenging struggle for folks who are dealing with bipolar disorder. If you find that you have a family member, you get into treatment, it's not uncommon to try 10, 15 different medications. And very oftentimes, the individual who's on that journey, they give up. They say, this is ridiculous. Right. Nothing's helping. The side effects make me sick, lethargic, gain weight, have a Pooh Bear brain, and they drop out of therapy. But when treated and when the right medication, whether it's a antipsychotic or a mood stabilizer or an antidepressant, with other combinations, when we find that right combination, an individual can live, a relatively, and I say relatively, a relatively normal, whatever that is, a setting on the dryer, life. But that journey to get there, I call Mr. Toad's wild ride. It's nothing short of a roller coaster. When you have a family member with bipolar, just when you think things are going well and your loved one or your partner is settling down, boy, a manic phase kicks in and the rug's pulled out right underneath you and your world is turned upside down. There's just very little ability to be able to predict it. We can stabilize it, but it's difficult to predict it.
Yeah, and I think understanding it's a disease of the brain. When you're on the receiving end of someone going through either the manic side or they're getting ready to go downhill towards that depression side, it can be really challenging. Hurtful things can be said, scary behavior. There's a lot of things that are going on for you. And I think I've heard both sides saying, well, the person that actually is, has bipolar disorder, they are already feeling ashamed and all of these things that can go on with having it. And then there's also this focus on that person and getting that person care, and then not enough focus on how do we also help family, friends, the people that are in their life every day to cope with what they're coping with as well, because they're a part of the equation too.
Oh, absolutely. And even when you have a family member, even when they're stable with their bipolar disorder, you, the primary caregiver or partner, you're constantly on guard, just waiting for that other shoe to drop. You listen differently. You listen to every word, phrase, you watch every action. You're looking for a cue that something bad is about to happen. Meaning you can find that, you're at the office and your phone rings, right? And so you miss the call of your family member who struggles with bipolar. And so you when you have a break, or maybe even immediately, because there have been so many ups and downs, you return that call. And when that person doesn't answer, it isn't the, oh, I'll try them again later. It's a, what's going on? Are they safe? Are they hurting themselves? Are they in a puddle of blood? Are they trying to kill themselves? Are they hurting other people? It's just the hypervigilance of the family members who have been on this ride. You've heard me talk in other shows that we've done on cortisol, which is the fight or flight hormone. And there's a chronically elevated level of cortisol that is present not only in the individual who struggles with bipolar, and mind you, that is just tangent. I say there's no greater pain, in my opinion, within the psychological realm in mental illness. There's no greater pain, emotional, physiological, than the individual who's struggling with bipolar. That being said, the family members who are around it in that constant state of arousal causes you to be on guard all the time. Your fight or
Right.
flight, your cortisol is through the roof.
Right, exactly. Exactly. So you're mirroring some symptoms sometimes just simply because your body's getting flooded with those same, cortisol, adrenaline, all of those things.
Well, and oftentimes family members don't realize it. So one of the things that I assess for when I work with families is, and I work a lot with folks struggling with bipolar, and I will always ask that their family members come in, and notoriously they will then enter into therapy themselves because they're so focused on keeping that family member safe or keeping the environment what they think is non-provoking, that they don't realize that they don't realize the magnitude of stress or the impact
Right.
that it has on their own life, because the focus is, you can be 1 minute getting ready for spring break only to find you come home and they're sitting in a puddle of blood in the bathroom. That's the level of threat that is often, especially in an unmanaged or when you're in that process of trying to find stability.
There's a movie, and I don't know if you've seen it, Lisa. It's called Love Actually.
I've not seen that.
Oh, okay. You need to rent it. It's such a great movie. It was really, really popular. Very, very popular movie. It's a wonderful Christmas movie, and there are different characters in the movie, and they're all interconnected in some way, but it's really about their separate lives. And one of them is this woman whose brother is in the hospital, and they don't say what his diagnosis is, but it's very much like what you're talking about. And she answers the phone no matter what. And people at her work in the movie know that she is allowed to get her phone, even if she's in a meeting. If it's him calling, she answers her phone. And it just made me think of what you're talking about. And of course, that's a movie, so not every workplace is that understanding, but it just made me think of that movie and go, I'm so glad that it was portrayed in such a loving way on film.
Well, it depicts it, and that reminds me of another movie, A Beautiful Mind, which while the diagnosis there is schizophrenia, but I mean that's an enthralling movie, and that's reality, for one suffering with psychotic illness, psychotic
Yes.
mental illness. And so I think that, I will watch this other movie, but I think it's important that people see that because, one of the things is living with a family member is the general public doesn't, excuse my French, they quote unquote, they don't get it. Right? They look at this erratic behavior and they think, good Lord, what is the problem over there? What's wrong with that family? What is all that screeching? Oh my goodness. Who's that running down the street? Oh my gosh, there's blood coming from their arms. Oh, here are the police officers. Oh my gosh, they've taken her down on the ground and they've got her in handcuffs and now they're off to the hospital. That family's cuckoo. Let's stay away from them.
Right.
And not only is there stigma, but there's bullying. In my family, it's a child, right? And so the bullying and the labeling that comes with the struggle of bipolar disorder is heartbreaking. And so movies like that, I wish more and more would come out and people would understand that bipolar isn't something that you ask for, that you choose. It's not something that you desire. It's not something that there's nothing fun about it. But the family members, being exposed to that, you'll find that you're no longer invited to, events, barbecues, gatherings. Your family member is not included in, golf tournaments or tennis tournaments or weekends away. But what happens with that is this concept, I call it borrowed shame or borrowed guilt, that we, the family members, begin to feel because of stigma, bad or damaged goods because of the severe mental illness that is one's experiencing in their home.
So how do you, when you're sitting down with someone, this is what I'd like to know, because I was diagnosed with bipolar 2 when I was in my very early 30s and put on lithium and put on, different medications. And we finally, a few years later, came to the conclusion that that wasn't the correct diagnosis for me. And because it's a process, for me, it was a lot of trauma and me living with a lot of PTSD, and time and therapy and medication for me certainly helped me to be able to process that, but it wasn't bipolar disorder. So sitting there and coming to the conclusion of a diagnosis for this, what is that process like? I know it's unique for everybody, but just maybe as generalized as you can, what is that like for you as the person sitting there going to make a diagnosis like this?
Well, I once worked with a psychiatrist years ago, straight out of grad school, and he told me that he doesn't diagnose bipolar disorder in anything less than a year. And I remember at the time thinking, wow, could it be a year that person goes undiagnosed? But bipolar disorder, particularly in adolescence, is difficult, if not impossible, to differentiate from oppositional defiant disorder, ADHD.
Right.
We often see a lot of substance use, abuse, and dependence. And then, many folks won't diagnose bipolar disorder during the adolescent years simply because of the hormones can look like bipolar in and of themselves. And so, when I'm sitting with someone, we look at what we would call differential diagnoses. And, as a clinician, and certainly I've been a clinician for 25 years, so you obviously, develop a profile, but it's not easy to diagnose. It's not easy to differentiate. And there's a lot of stigma. So the individual who's struggling with bipolar disorder doesn't want that diagnosis.
Yes.
I mean, I know with my daughter who's 18, out of the gate, very early, we saw what looked like ADHD and classic ADHD. But boy, early on, and this is a weird way to say it, I smelled bipolar. And I'd keep an eye out and I would talk to her practitioners. And of course, I'm too close to the scene to be able to diagnose a family member.
Right.
But I would come back to that. And I know that, repeatedly, not only with my daughter, but with the practitioners, my daughter would say, you just want to label me and you just want to put me on drugs. And that wasn't my goal. I wanted her to find relief. I wanted her to find freedom. And truly, for us, Kristen, I think it was about a 6 to 7 year journey to find the right medication. And then when you find the medication, because the medication happens to be a antipsychotic, not a stimulant, therefore the diagnosis is then now imprinted. So she has hence responded best to an antipsychotic and has found tremendous stabilization. She's thriving like I've never seen her thrive. But in that process, you try the Vyvanse, the Adderall, the Ritalin, the Prozac, the Effexor, the Wellbutrin, the Lamictal, the Abilify, and it's a long process. And so with the individual, I tell them out of the gate, this is not an easy process. It may take us several years. I hope and pray that it doesn't, but it may. And with good psychiatrists, I mean, we've had Paul on this show, and he's got it down pat. He's got, he really is able to see it and nail it, and he's got great protocol and has really been even helpful in our own life, in our own walk. But without that expertise, these people can hop from practitioner to practitioner, from MD to MD, and really get frustrated and drop out of therapy.
Yeah, and when you're the medication roller coaster, I mean, I went through it trying to just stabilize what was depression for me. That road is not fun. I mean, lithium for me was like, okay, you now walk around with your feet encased in cement and you would eat your own arm off because you're hungry all the time.
Pooh Bear brain, you can't you can't kick the brain in. Absolutely.
And and I missed those highs that I would get, and I was called a rapid cycler and all these different things back and forth. But the thing that wasn't done correctly was it was first visit with someone new. This is what you've got, and this is what we're going to do. That was what was not the good thing.
Well, and so to track back to your question, one of the things that I will tell folks out of the gate, and with bipolar disorder, because it's a disease of the brain, you really do need a treatment team. So, an unprepared, unskilled therapist without a clear understanding of neurochemistry is not the right person to be with. You need to have an MD, you need to have someone who understands neurochemistry and the functioning of the brain. You need to have some family members who can give you a report from what's going on at home. You need a treatment team. But what I tell people, and family members or clients, is that we need to remember that not only medicine, but mental health medicine is an impure science. And this is part of our process, is trial and error, and trying to, with the area of expertise, try to narrow down the amount of trials that we go on. But, one of the keys to survival as a caregiver, as I've mentioned here a couple of times, is to see bipolar as a disease of the brain, and to be angry at the disease and not the person. Because the person who's struggling with bipolar can be quite unattractive. They can be mean, they can be destructive, they can destroy property, they can destroy relationships. They can be physically aggressive, not only to themselves, but to other family members and other people. And so it's difficult at times, for a family member to be that advocate. I mean, one of the most important components in the treatment of bipolar disorder is to have that advocate. So whether it's your partner or your family member, there's so much as a family member that we are unable to do with bipolar disorder. But the one thing that we can do is to be an advocate. But it's difficult to hold that line if you're on the receiving one who has just been physically attacked and is suffering from lacerations. So that's not something easy to talk about at coffee either. Oh yes, I have stitches, up my arm because I was sliced with a knife. That person is going to be considered a delinquent or needs to be in jail, when in fact, no, this is the disease of the brain, and we need to pursue and stay true to looking for the right treatment protocols.
That's such a great point as well. When we look at this, the first thing I thought of when you said you need to look at this as a disease of the brain, this person, we be angry at that, not at the person. And also, I think for parents looking at it and going, it's not okay for you also to be angry at yourself. Like you didn't cause this to happen in your child.
Oh, Kristen, that is the biggest thing when family members come in, is the guilt. What did I do? Should I have been working? Should I not have been working? Should I have had the biggest one, better boundaries? Did I not have good boundaries? My child is destroying property. Now they become oppositional defiant. They're going to end up in the legal system. What did I do wrong? Yes. And, once we narrow down that, no, this is a disease of the brain. That brain operates differently. This is not your fault. And grieving the powerlessness that it is a disease like diabetes. It requires medical treatment and to stay on the medical treatment. We both know that, people with bipolar 1, oftentimes, as you were mentioning, the side effects of the medications are not always so pleasant. Now, there are a lot of medications that don't have those negative side effects, but one of the biggest problems with the treatment of bipolar disorder is compliance.
Hi, this is Dr. Paul Meyer, founder of the national chain of Meyer Clinics. I've often told you about how people just like you are getting the healing that they need from emotional issues like depression, anxiety, anger problems, and relational problems. We wanted to share with you Mickey's experience at our day program and how it has affected his life.
The Meyer Clinics has been a real blessing to me. Dr. Meyer told me that people get well here, and my life has been completely changed. I have been symptom-free for 3 years, and I'd recommend it to anybody that really wants to overcome an emotional problem of any kind.
Mickey's story is like so many others that we receive. It's an encouragement to us, and we hope it will also be an encouragement to you to call us to get the emotional help that you've needed. Please call toll-free 888-7-CLINIC to be connected to the Meyer Clinic program nearest you. That's 1-888-7-CLINIC, or go to MeyerClinics.com. That's www.meierclinics.com.
Yeah.
People don't like the side effects. So looking at what's the medication that's going to have the greatest therapeutic effect and the fewest negative side effects, again, a bit of an art in and of itself.
Yeah, and I think what's been interesting listening to Dr. Paul Meyer talk about these things on different shows that we've had him on is, you're right, how quickly he understands that, because he understands, being a psychiatrist, he understands the science behind it, your genes, all of those things that come into play in this. And because he's been doing it for so long, he can just boom, boom, boom. This is what we need to do. Let's up that. Let's take that down. Let's do this. And it's really fascinating to talk to someone who knows the science behind it.
Well, and that's in what I would say a clean diagnosis. But the problem with bipolar disorder, bipolar 1 and bipolar 2, is what we call in the field of psychology comorbidity. Mm-hmm. And it's interesting because with bipolar 1, which is the severe one, the mania and the depression often find, hospitalization, there is a comorbidity with alcohol, substance use, abuse, and dependence. In fact, 60% of folks who have bipolar 1 disorder are known to struggle at some time during their diagnoses with abuse and dependence. And I think it's a little less, maybe 40% for bipolar 2. And so you get someone coming in who looks like an alcoholic, And so they go through alcohol treatment. They go through 30 days of rehab. They do a year of sobriety, and they get off the alcohol, they get off the substances. But then we have the clinical picture of the bipolar disorder. So, when we have a clean diagnosis, that certainly aids in diagnosis and treatment. But the problem with bipolar 1, I mean, in fact, we think about bipolar depression and unipolar depression. And unipolar depression would be what we would consider a run-of-the-mill depression, not to be minimized. But bipolar depression, alcohol dependence, is twice as high in bipolar disorder as it is in regular major depressive disorder. But if you think about mania, it's 6 times higher. Alcohol abuse is 6 times higher than any other mental illness. So it's a puzzle, where that's why it can take years. It's not necessarily malpractice or the wrong practitioner, but it's not clear. It's an impure science.
Right. So what does it look like when you are, you've gone down this long road and you finally think that you have found the right medication, combination of medication and treatment, mental health treatment? What does that road start to look like for people when those pieces have been worked long enough and figured out?
When the individual with bipolar is stabilized?
Mm-hmm.
What I often see, Kristen, and this I have to really, I don't want to say I have to really look for, but people don't generally present to therapy for it. So here we have the family member is stabilized. And so everybody's taking a deep breath, though they're still a bit hypervigilant, listening to every word. They still get up at night and check that person or roll over and check that person to make sure they're breathing. And I kid you not. But what happens is the family members, they feel so much relief in the stabilization that it's woohoo, skippity doo-dah, life back to normal. But what I then begin to notice is PTSD in the family members. Right. That because of that chronically elevated level cortisol for 3, 5, maybe 10 years, they have developed themselves hypervigilance. They have developed themselves major depression or generalized anxiety. They've become socially isolated. They've lost interest in the activities that they enjoy. They no longer, socialize in the way that they've done. And so when things are stabilized, and it's probably 6 months to a year after that, that you will begin to see family members present. But again, because it's so and I don't want to say less severe than what they've seen with the severity of the bipolar disorder, they don't seek treatment because that's nothing compared to the chaos that the war zone really that they have been in for the years. And so, what I tell family members, the most important thing, above all, is that whether you're in an active bipolar process or things are stabilized, is that before you can take care of your family member, you have got to take care of yourself. We talk about, when you get on a plane, we put the oxygen mask on ourselves first before helping those around us. But this is easier said than done. So if you're asking a family member, it's important that you take care of yourself. That's easier said than if they've spent 3 nights in a row in the ER because of their family members tried to kill themselves, or they're traveling 2 hours to and from a mental hospital to see that family member, or they've been hospitalized for the umpteenth time. It leaves little time or motivation for self-care. So that self-care falls off, it falls off the radar.
Right. Absolutely. Yes. That self-care falling off and the accumulation of the lack of self-care. And I mean, I've seen people, you get stuck in those patterns, you get stuck in that way of living and having to readjust yourself to this person. You might have gotten a little bit addicted to that chaos and drama, and your body chemicals are betraying you because, you're flooded with cortisol and adrenaline and all of that. Then you are addicted to those things, or you can become that way. And so you almost miss some of those highs and lows that were going on, even though you don't want that for that person at all. But I've had people, tell me that, I actually missed some of the chaos because it gave me excitement in my life.
Excitement, or they've developed substance abuse issues,
Yes.
to numb or distract or to endure. And, I tell family members, it's so important when you find, if you find yourself struggling, to seek help, to get involved with a therapist. And as you mentioned earlier, guilt and shame, those need to be confronted. Those need to be worked out. And typically they need to be worked out with a therapist, because friends and family will look at you and think, what if, you got to get it together. Don't tolerate that. Kick them out.
Right.
I wouldn't put up with that. And so people too close to the situation oftentimes are not very helpful. But if you can get help with a therapist and even maybe need medication and support, it's very helpful. Another feeling, that oftentimes family members will discuss with me is a feeling of just wanting to give up. You wanting to get away, from the situation. And while certainly that's an option, it's never a solution. I mean, you can't leave your child. You can't, well, I guess you could leave your partner. But, while there's so much, as I said, that we can't do with bipolar disorder as a family member, there's so much that we can do to advocate, in seeing this disease as the enemy, not your loved one as an enemy.
So how do you deal with that? Being in the field that you are, you have an advantage of knowledge around this, but then also, having a child with this and having to deal with all of the ramifications and things that you've had to deal with that you come from your own personal experience here too. How have you walked through that with, neighbors, friends, family, school, all of those things?
Oh, I wish I could say that was a happily ever after. I would say that it's a marathon, not a race. I would say that it's a solo journey. And I would say that people who love you, friends and family, they love you and they'll be there for you. Some who are aware of mental illness or have other families who have struggled with it are going to have a greater understanding. One of the difficulties is the closer the person is to you, the more they want to protect you, because
Right.
you, the family member, you have been physically attacked. You have been emotionally abused. You have, in some situations, people steal, they lie, they destroy property. And so the closer the proximity of the relationships, the more those people want to protect the person who's living with the person diagnosed with bipolar disorder. So it's a lonely road. And that's why, what I practice and what I teach people is, out of the gate, if you suspect that there's bipolar, or if there's indeed a diagnosis and you're a family member, the very first thing you want to do is to learn as much as you possibly can about bipolar disorder. You want to learn to accept that it's an illness and that life will, in many ways, never be the same. It's not an antibiotic. It's not going to be taken away. It can just be managed. So we want to learn absolutely as much as we can. And we want to be prepared that there will be times, even with medication, that they're going to lose control, or that they're going to cycle, or that they're going to miss medications and we're going to have a relapse. And so we want to learn as much as we can. We want to, as a family member, we want to understand that bipolar, while it's a diagnosis, it's an understanding, it's not an excuse. So when you have a child with bipolar, you got to weed out typical teen rebelliousness and hormonal fluctuations. But learning as much as you can about bipolar to know, nope, this is mania. This is not sassy pants. This is mania. This is not just being difficult. And then as a family member, again, we want to know what we can do is to encourage your family member to get help as soon as possible. Too oftentimes there's denial. We want it to go away. We want to believe it's going to get better. We want to think that it was just the stress or the move, or the rejection or the abandonment. And when there's bipolar on board, the sooner we can educate ourselves and the sooner we can encourage that person to get help, the greater the likelihood that things will stabilize. I mean, as I said, bipolar is a real illness, just like diabetes, and it requires medical treatment. And with medical treatment, people can stabilize. People can stabilize. The other thing we want to do, and this is very difficult as a family member, is we want to be understanding. We want to let that family member know that we know this isn't easy. We know that this is difficult. We want to be patient with them. We want them to know that we see that this is a disease. We want to say things, such as, you're not alone in this. I understand that this is a real illness and it's causing these thoughts or feelings. We want to tell them that that person, with my daughter, I say, you may not believe it now, but the way that you're feeling, it will change. The way that you're feeling, it will change. And I may not be able to understand exactly how you feel, but I care about you and I want to help. You're important to me and I'm on this ride with you. And truly, I call it Mr. Toad's Wild Ride. And when those symptoms pop up, I say, I'm on this ride. We're on this ride together. But Kristen, and I emphasize to everybody out there in our listening community, that's easier said than done.
Right.
Because when you are on the receiving end of the mania, it's exhausting, it's hurtful, it's painful, it's isolating. When you're with a family member out to dinner and that person has an episode, you have to leave. Sometimes you have to abandon vacations. Sometimes you have to abandon plans. Sometimes, as you said in the movie you were watching, you excuse yourself from a dinner party because you need to go take care of things. Right. And you'll get accused left and right. Oh, you're being codependent. She's manipulating you. You're enabling. And to the extent that we can educate people that this is mental illness. And I know that for me, when I was able to call it that, it was really freeing, that this isn't my rebellious, fiery child. This is mental illness.
Right.
This is mental illness.
Yeah. And, boy, does that person need people in their corner during that time. And, if this is a friend and you are going through your own issues in your life and you just can't deal with what's going on with them, a friend, because of what's going on with you, as I've had to do that. I was going through a horrible time, my own horrible time. And I had someone go through an episode and just lash out so bad. And I just was like, you know what? I can't. They have family, they have a support network. So they're okay. And I have to dip out and take care of myself because I can't go through what I'm going through and process the hate coming at me, which was the mental illness, not that person. But, we connected later and smoothed things out. But I said, listen, I could not be a part of it this time because of what I was going through. And it was okay.
Well, and that is one of the main things that I say to people is that you need to accept your own limits. And that's whether you're a friend or a family member. You need to know when you need to take a break. You need to know when to ask for help. We can't rescue our loved one with bipolar, and we can't force them to take responsibility for getting better. But we have to know, two things. We have to know our own limits, and we also have to accept the limits of our loved ones. They may not be able to navigate a conversation with us if they're manic. They may not be able to be reasonable or understanding. They may not be able to navigate holidays or birthdays or travel without being completely overwhelmed. And so, again, you ask, what do we do or how do we approach it? Being able to accept your own limits is pivotal to navigating through this process.
Absolutely. It's so interesting to be in the field, and I'm not here as a therapist or counselor. I'm in the field as a business person and also someone who has mental illness that rears its wonderful, interesting, and ugly head at different times. But it's interesting to navigate that road, understanding that somebody's lashing out. I don't immediately rush to some kind of judgment about it because I know this person, I know their history. Could be something going on underneath, while also going, I got to take care of myself. I really got to take care of myself. It's an interesting road.
Well, it is. And so, in taking care of self and then living with someone with bipolar or being in relationship or having a friend with it, we know our limits or we have realistic expectations from them. But we also want to look at that they're operating differently. And so to the extent that we can reduce stress, in our life and in our loved one's life. But what you point to, which is so important, and we don't do it because of the stigma, we want to communicate openly about it. During stable times, we want to look at, okay, when things get rough, this is our plan of action. This is what we're going to do when things get rough. And as a family member, to the extent that you can know your emergency room protocol for mental illness, to the extent that you can know when you can help or not. And fortunately, I've not had to deal with some of this, but oftentimes when people are bipolar, not only are they at risk of hurting themselves, but they can be violent and you can be at risk of being hurt yourself. And so, knowing that it's okay to call for help, i.e., 911, in order to, and discussing, with your family member that if things get to the place that I believe you're in danger of hurting yourself or others, I will need to call in help. And you discuss and you communicate these things openly during stable times. And that's a part of what we call being a partner in treatment. We want to go along with them. We want to help them set up appointments. We want to support them.
Yes.
Oftentimes, we want to monitor their medications. There's lots of family members who the supportive advocate does medication. They give them every night or every day or on the protocol, because the one with bipolar disorder doesn't trust themselves. And so,
Right.
knowing that medication is cornerstone in the treatment of bipolar disorder, being a part of that team is essential. And also, in that education component, educating ourselves about warning signs, because even though medication can stabilize, as I mentioned, people can miss medications, illness can affect it, hormones can affect it, developmental stages of maturation can affect it. And so knowing, what warning signs of mania are, when someone's sleeping less, or their mood goes crazy, or they're restless, or they're speaking rapidly, or they want to start a new business, or noticing the third one, or noticing what depression looks like, fatigue, lethargy, sleeping, staying in bed all day, they're not concentrating, they're not checking in with you. Knowing, those warning signs often will help you navigate, prevent a relapse, but also know that, what, this isn't a good time. I mean, people can laugh and maybe think that I'm cuckoo on this, but I track the moon. And I track the moon, and there is actually some research in that with a full moon affects the electropolarity of the brain.
Yes, it does. I mean, emergency rooms and police stations will say, this is not witchcraft. This is tidal planes, and
it's electropolarity. And I'll say to my daughter, I'll say, sweetheart, we've got a moon coming up on Friday. And what I've noticed is the first 3 days, or the 3 days prior to a full moon. And what I tell people, and I think I've shared this with you before, Kristen, is that it doesn't mean that you're going to grow hair and go out there and howl at the moon, but whatever we're feeling, we feel it bigger. So if a person with bipolar is in a good space, they're going to feel better. If they're in a manic space, they're going to feel more manic. If they're in a depressed state, keep an eye. Don't leave them alone. Stay around. And then oftentimes people will say, what do I do, if my family member is in these phases? If they're in a manic phase, go on a walk with them. Be with them. Don't desert them. It's a scary existence. And the individual who struggles with bipolar disorder, it's not, I say Mr. Toad's Wild Ride, which is a fun ride at Walt Disney World, but there's nothing fun about this ride.
And
it's a scary place.
When your friend is on a medication protocol, they are being treated, they're doing everything, and they're in a stable place. And when they say to you, no, I can't go out dancing. No, I'm not going to have a drink. No, I can't stay up late and talk to you on the phone until 1 a.m. You have to respect them and say, okay, don't push them to go outside of the way that they have crafted their life in order to live with this disease.
It's real.
That's the biggest thing. I mean, I know that when I call one of my friends, because I stay up late, I know, okay, that's right. Can't call him after 9 o'clock, because he'll thankfully tell me, listen, my Seroquel just kicked in and I'm going to be gone in like 3 minutes. I'm out.
and holding space for them.
Because people saying, sorry, called late. Sorry.
And because the phrase bipolar is so overused, people tend to minimize it, and people want to deny it and believe that it's not there. But, and bringing full circle, though, for family members, if we can think of nothing else, I always emphasize these 5 things. When we have someone who is with bipolar, it's important that we focus on our own life. It's important that we attend to our needs for exercise, a balanced diet, nurturing social interaction, not to disregard that. Now, during crises, it's going to go on the back burner, but we want to keep forefront that oxygen mask. We want to seek support. We want to educate our friends, our family. We want to seek support by therapists, groups like NAMI. We want to be clear on our own boundaries. We want to have realistic expectations of what we can and cannot do for this person. We want to manage our own stress levels. We want to look at what is the impact that this is going to have on me and on my family member who has bipolar. And finally, I just can't emphasize this enough, we want to ask for help. When we have a family member who has severe mental illness, who struggles with bipolar disorder, we isolate, we pull in, we withdraw, we're the freak on the streets. We want to just everything to be calm. And we move into our own denial. And the more we can say, no, this is real and I need your help. And you will find people will show up, Kristen. You would show up, I show up, that to say, how can I help? I need you right now. I need you to pray for me. I need you to hold space for me. I need you to go pick up my dog and take my dog because I'm at the ER and we're headed to another psychiatric admission. We want to ask for help. And with that, in that team approach, we can, if we take care of ourselves, it's the best gift we can give our family member, because then we are in a position of being an advocate, which is a lifelong journey in being their advocate and struggling with their disease.
Absolutely. Well, Dr. Lisa Day, thank you for wanting to talk about this and for being willing to, share how this has affected you personally too.
It's Mr. Toad's wild ride. And I laugh, not to minimize it, but I wouldn't trade it for anything. It's a very, very fruitful and very, very adventurous journey. That's for sure.
And listeners, we're going to do a after show video talk. Dr. Lisa Day and I, make sure to check that out on Meier Clinic's YouTube channel. You can just go to YouTube and type in MEIER Clinics and you'll see us there. We'll be doing a lot more of these lately, but today I thank our listening family for tuning in and letting us share with you what it is to live with bipolar disorder. Thank you so much.
Thank you so much, Kristen.
We hope you enjoyed this podcast. Tune in next time for another engaging discussion on relevant mental health topics. If you have any questions about Meier Clinics, please visit our website at meierclinics.com. That's MEIER clinics.com, or call us at 888-7-CLINIC. Don't forget to leave us a review on iTunes, Stitcher, or any of your favorite podcast apps. And please note that we are a member of and produced by Mental Health News Radio Network, MHNRnetwork.com.